During inpatient time, there will be Ayurvedic therapies, multidisciplinary therapies, and you are engaging kids with some other activities also. So the whole day for the kid is like a training.
Yes, your that word is very much correct, because it's like a training only. Because many people are asking me whether we can do Panchakarma treatment in our area, and you just advise us the dietary regulations. We will follow up in our home. So all those things, what I feel is, I was saying that as a parent, it will be very difficult for a parent to implement new things, because I am also a parent. I know it will be very difficult for me to implement the new things in my home or to my son. Somebody should control me for that, for a good cause. And it's not easy to implement new things. It's a learning time. So for that, I need to correct the diet. So in our inpatient treatment time, our day starts with around 6 o'clock, 6:30. They should get up by that time. Even if they are not having sleep at night, also we'll correct the biological clock. So 6:30 when they are getting up, we'll give that herbal drink. They will have a barefoot walking. They used to have a sun bath. Then exactly 7:30, the canteen, our Annapurna hall will be opened. There they have to sit down and take food. So while sitting down, not much belly full we can't take. So automatically you will take only half stomach. That is enough actually, because our stomach size is only this much. This is my stomach size. So the concept right now is we have to dump everything to the stomach, nothing like that. This is the only quantity that I can take at a time. In that quantity itself, it should be half, it should be a solid food. Quarter part, it should be liquid. Quarter part, we should kept empty. So automatically, if we sit down and take food, this concept will come. And the kid should wash the plates. They will wash. Only thing the parent has to just insist. It need not be perfect, but still that habit should generate. Then we will have our Ayurvedic treatments. And Ayurvedic treatments also we are dividing into 21 days is the first course. We will divide into three phases. In the first 7 days, we will be doing proper gut correction and the channel opening type of treatment. Second 7 days, we will be doing proper body cleansing will be done. Third 7 days also, we will be doing brain regenerating. So Ayurvedic treatments will be there, and that also it's not having soothing effect, because our ultimate aim is two things. First thing is we should make the kid whatever to accept whatever they doesn't like. Second thing, we should train your kid to restrict what they like, because kids show hyperactivity and tantrums for two reasons: to get something or to get rid of something. So if you are they able to accept the negative emotions and what they doesn't like, that is the success for a long-term happiness. So Ayurvedic treatments will be there. In between, we'll be having some concept called figure eight sensory walk, because that figure eight will have a proper balancing of the mind and body in Siddha tradition. So figure eight sensory walk will be there, and it's a sensory walk area is there. So it's a concept of occupational therapy. So they will have more relation with the nature, to the earth. And along with that, lunch will be in the stipulated time. Afternoon, instead of tea and coffee, we'll be giving some japi, it's a herbal drink, and the snacks will be there. Night 7 o'clock we'll start our dinner. By 8 o'clock it will finish. So what happens is, we are seeing that automatically after 3-4 days of admission, that stipulated time the kids are getting hunger automatically. We are seeing by 6 o'clock in the evening itself, kids are in front of the canteen to open up the door. The parent is first time seeing that he is waiting for food, because till now we have seen that parents are behind to feed them. Only here they are waiting for food. So it's only because of training. So this is what Ayurvedic and other part we are doing. Along with that, we are having our child development center. There psychologists are there, speech pathologist is there, occupational therapist is there, all the multidisciplinary professionals are there. During these 21 days, we more concentration will be given for having a proper assessment, because there every therapy center is lagging. Everybody is behind giving therapy, but They are not having a focus. What we do in our therapy center is they will do proper assessment and they will come up with an advice for next 3 months. In that next 3 months, what are the preference should be given? Maybe we need to improve the speech, but with the assessment, he may be in need of sensory integration therapy in the first preference. Second preference may be occupational therapy. Third preference may be behavior therapy. So accordingly, they will advise you what therapy will help you, and we will plan for 3 months goal setting also. And after 3 months, we will do again one more assessment. Then we'll monitor what is the change happened. Maybe in the after 3 months assessment, we may be in need of our preference, change the preference. That time behavior therapy sometimes come up, preference one. Second, it will come speech therapy. So like that, we should monitor everything. Then only we should go ahead. So with this, our 21 days of therapy will do basic gut correction we are doing the acceptance of mind so that the parent can continue this easily. Whatever the restriction that I am saying, it only maximum for 8 to 10 months. Even gluten and casein we will add up in the second stretch. In the second stretch of treatment means we are giving after this 21 days, we are giving treatment after 6 months, before 8 months. 14 days of treatment. Again after 6 months, before 8 months, third course of 14 days. This is the maximum we have done. And the protocol what we have made after 6 months, before 8 months means in every kid there will be some gut impairment in every 6 to 8 months. Automatically it will happen. So within 6 to 8 months I have to put them to the routine again do the gut correction. Third time also in the same time interval we have to boost up. It's like a booster dose of vaccines. So fourth time also gut impairment will happen, but at that time body itself will correct it. So we are giving training for the body to correct the gut. So basically body itself is doing. For that we are giving some booster dose of correction. That's all. This is the protocol that we are maintaining right now. And my kind advice for all the parents is not, you should not come for a leisure over here. There should be only one aim for a parent as well as the staff over here, and for me also. It should be the betterment of our kid, and it should be like a long-term happiness also. So I'll make the parents suffer a little bit, because unless until they suffer, they will not get the result. So getting the proper treatment is a grace. Getting 21 days completed with successful manner is little more effort and grace is needed, because many a times I have seen within 1 week they will get discharged. They are saying that my kid was fond of taking biscuit, I need to give him, let him enjoy in this age. I just say that you can just get discharged. I will not give, because again what I said is they are into the comfort zone. They need to give biscuit to the kid, so that kid will be happy at that time, parent will happy, let them suffer, because it's not the proper time. So like that also cases came. So those parents who are need proper result and they are able to sacrifice their happiness for maximum, I am saying for 1.5 to 2 years, not more than that. After my second stretch of treatment, I will introduce even gluten, even casein, whatever we have denied, we used to introduce that, because we are doing the basic gut correction so that we are able to implement. It's not for lifelong, but within this time span it should be, effort will be there. So those who have or willingness to put their effort only, please come, otherwise you can be aside. Okay.